Good morning, my name is Yasmin Garcia. Today I'm going to be performing a physical head-to-toe assessment on an adult patient. The physical exam is going to consist of mental status, head and neck, eyes, ENT, respiratory, cardiovascular, breast, abdomen, genitalia, musculoskeletal, and neurological. The equipment that's going to be used for the physical exam includes gloves, a stethoscope, the eye acuity chart, the reflex hammer, the tuning fork, some thumb blade depressors. I have the equipment to do the neurological assessment, and I have the ophthalmoscope and otoscope. Good morning.
Good morning.
How are you feeling?
Good, good.
What is your name?
Luis Nieves.
Do you know the date?
Today is the 21st, February 21st.
Do you know where we are?
We're in your clinic.
How are you feeling?
I'm feeling good, thank you.
Do you have any? Why are you here? Like, are you gonna?
I'm just gonna do my physical exam today.
Okay. Well, I'm gonna proceed with the physical exam. Okay. With the appearance, you look clean. You seem calm. No distress. You answer all my questions correctly. Now I'm gonna start with your head. Okay. Your eyes seem symmetric. Your ears seem symmetric. The skin, I don't see any skin problems. I'm gonna see the head. On your head, I see some hair loss. Now I'm gonna be touching to see if you have any messes, okay?
Okay.
Well, I don't see or I don't feel anything abnormal. In the face, you're warm, pink. I don't feel any masses. Mr. Nieves, I'm going to be performing the assessment of your eyes. For the eyes, I'm gonna use the acuity chart. Since you're an adult, it's gonna be 20 feet away. You're gonna read me the letters from right to left or left to right. For children, it has to be 10 feet away, and we use an age-appropriate chart. So I'm gonna put this one 20 feet away. You read from this one to this one, okay?
Yes, ma'am. SDKH
Thank you. Now I'm gonna use this ophthalmoscope to see your eyes, okay? Let me turn it on. Really good. Can you close your eyes? I don't see any problems with how your eyes look. They constrict. Mr. Nieves, I'm going to be assessing your neck region. I'm gonna be touching it. Is that okay with you?
Yes, ma'am.
Okay. Do you have any neck problems?
No, ma'am.
Any swelling problems?
No, ma'am.
Okay, I'm gonna be touching the lymph nodes. I don't see any nodules. The skin looks good. I'm going to go behind you and swallow. Okay, ready? Thank you. Your neck looks good. Mr. Nieves, I'm gonna proceed by assessing your ears, nose, and throat. So for the ears, I'm gonna pull up and back since you're an adult. For children, I would do it down and out because of the age. Okay, so I'm gonna start with the ears. I'm gonna go to the next ear, okay? They look normal. I'm gonna proceed to do the whisper exam. For the whisper exam, I'm gonna mention 3 numbers or letters. You're gonna repeat after me when you listen, okay?
It was 1, 2, 3?
Yes, correct. Now I'm gonna be using the tuning fork. So I'm gonna put it first on the top of your head. You let me know once you stop listening to the noise, okay?
Okay, yes ma'am. Done?
Thank you. I'm gonna go to the ears now. I'm gonna put on the next to your ears. You let me know the same, okay?
Okay, yes ma'am. Done?
Thank you. Now I'm going to go with the nose, okay? So I'm gonna be looking at your nose. Do you have any breathing problems?
No ma'am.
Okay. Well, your nose looks symmetric, okay? Can you look up?
Yes ma'am.
Thank you. Thank you. Do you have any swallowing problems?
Oh no ma'am.
I'm gonna be looking at your mouth, okay?
Yes ma'am.
Well, everything looks normal. It looks pink. I don't see any teeth problems. Thank you very much. Mr. Nieves, I'm gonna proceed to do the respiratory assessment. First, I'm gonna look at your chest, then I'm gonna touch it. Following that, I'm gonna percuss it. Then I'm gonna auscultate it with my stethoscope. Is that okay with you?
Yes ma'am.
Okay. So can you stand up? Thank you. I'm gonna start with the back. The skin, it looks good. There is no bruising, no bent skin. It looks good. Can you breathe in and breathe out? It has symmetrical movements. Now I'm gonna do the chest on the front, okay? Can you breathe in deeply? The skin looks good. I see equal movements. Now I'm gonna be touching you, okay?
Yes, ma'am.
Can you breathe in and out? Really good. Then I'm gonna percuss it. I don't see any problems or any fluid on the base of your lungs. Now I'm gonna be listening to your lungs, okay? Can you breathe in and out? You have clear lung sounds. Now I'm gonna do the front. I already saw the skin. Now I'm gonna be touching you, okay? Can you breathe in and out? Thank you. Now I'm gonna percuss you, okay? I don't see any fluid also on the base of your lungs. Now I'm gonna be listening again to the you have clear lung sounds, okay?
Thank you.
I'm going to be doing the cardiovascular assessment. I'm going to be looking at your body, Following that, I'm going to be touching you, then listening again to your heart and to your neck. Okay?
Yes, ma'am.
So I'm gonna be looking at your neck. I don't see any problems with your neck. I don't see any jugular vein distension, which is good. On your skin, you look pink. You look, which is appropriate. Now I'm gonna be touching you. Okay?
Yes, ma'am.
I'm gonna be touching your pulses. I'm gonna do one at a time. I'm gonna be doing that. I have good pulses, +2 to the upper body. Now I'm gonna go to your feet. I have strong pulses and the femoral. Now I'm gonna be listening to your hearts, okay? Here I'm gonna be looking for you to have normal heart sounds. So no murmurs, no clickings, no gallops. First I'm gonna also listen to your neck for the throat. Now I'm gonna be looking for the capillary refill. Your hands look pink. It is less than 2 seconds. It is less than 2 seconds, and they feel warm. Thank you.
You sure?
Mr. Nieves, I'm gonna proceed with the abdomen assessment. First, I'm gonna look at your skin. Then I'm gonna listen, auscultate, then percuss. At the end, I'm gonna be putting some pressure. Do you have any pain to the
No.
abdomen?
No.
Okay. Let me see for patient privacy. Let me see. I'll put you below.
Oh, okay. Thank
Below
you,
will
ma'am.
cover you.
Thank you. Okay.
So first, I'm gonna look at your skin. Okay.
Yes, ma'am.
Your skin the abdomen looks symmetric. It looks pink. I don't see any masses. Now I'm gonna listen. Okay.
Yes.
When I listen, I wanna know if you have more than 5 clicks within less than a minute. Okay. Now I'm gonna percuss. Okay. Now I'm gonna put some pressure. First it's gonna be light, then it's gonna be deeper pressure, okay? Do you have any pain?
No, ma'am.
No, it's gonna be deeper, okay? No pain?
Okay.
Now I'm gonna be touching the edge of your liver and spleen. I'm gonna have you have a breathe in, okay?
Yes, ma'am.
Can you breathe in? Out. No pain?
No, ma'am.
Now on the other side, okay? Can you breathe in? Breathe out? Thank you. Thank you. I'm not going to be performing the actual breast exam and the genital exam on the patient for patient privacy, but on the breast exam, we're also gonna look at the skin. We're gonna feel for them to see if they have any masses or lumps and discharge. On the genitals, it works the same way. We look at the skin to see if they have any lesions or any abnormalities. Also, we're gonna see if they have any discharge. Then we follow with the rectus. We check rectal tone. We see if also the enlarged prostate of the males or any masses. Thank you. Assessment for the musculoskeletal. I'm gonna be looking at alignment, symmetry, range of motion, and strength. Then I'm gonna do your reflexes. Okay? Do you have any pain?
No, ma'am.
On your extremities?
No.
Can you rotate your shoulders? Do you have any pain?
No.
No? Okay. On your arms, can you raise them?
Yes.
Thank you. They look symmetric. They look the same. Can you squeeze my fingers?
Yes, ma'am.
Really good. Can you raise your hand? Lower your hand?
Yes.
Can you bend your... Okay, can you push outside? Push inside?
Yes.
Thank you. For your legs, can you raise your legs? Really good. Can you push in? Push out?
Yes, ma'am.
Thank you. Do you have any pain?
No, ma'am.
The legs, they look symmetric and they seem aligned. Now I'm gonna check your reflexes. Can you sit on the edge of the
Of course.
table? Thank you. I'm gonna go to the bottom. Thank you. Now I'm gonna be checking his my patient's gait. I'm gonna have him stand up and see his balance. Let me move the table. Can you please go to that side of the room and walk across the room?
Yes, ma'am.
Thank you. I don't see any gait problems. Now we're gonna be checking the cranial nerves from 1 to 12. So for the cranial nerves, I'm gonna be doing multiple exams. First, I'm gonna start with cranial number 1, which is the smell. Can you please close the eyes and tell me what smell you smell? Okay.
Is cinnamon?
Cinnamon.
Yes, ma'am.
Correct. Following this, we're gonna be doing the cranial nerves that evolve around the eyes, which is cranial nerve number 2, 3, 4, and 6. We already did the Snellen acuity chart. He did fine. So now I'm gonna make you follow my finger. Yeah, I'm gonna be checking for any nystagmus. Okay?
Yes, ma'am.
Follow my finger. Thank you. I didn't see any nystagmus. Now I'm gonna be doing the facial cranial nerve, which is I see you, the number 7. Can you please smile? Can you raise your eyebrows? Now I'm gonna be trying to open your eyes and mouth, and you close them, and try to leave them closed. Okay? Close your eyes. Thank you. Close them. Thank you. You did good. Now I'm gonna be doing the cranial nerve number 9, 10, and 12 that evolves around the mouth. Do you have any swallowing problems?
No, ma'am.
No swallowing problems. That's cranial nerve number 9. For the 10, I'm gonna have you open your mouth. I'm gonna see for the rise and fall of the jugula. Can you open your mouth? Thank you. Now can you stick out your thumb? Move it from side to side. Thank you. That's cranial nerve number 12. I'm gonna go back to one of the cranial nerve number 11. Can you raise your shoulders?
Okay.
Thank you. Now I'm gonna have you close your eyes. I'm gonna be touching different parts of your face with a cotton. Tell me where you feel it, okay?
Yes, ma'am. Okay.
Where do you feel it?
In the forehead? my nose, my cheek, right cheek, and my left side of the face.
Thank you. Now you can open your eyes. Right now I'm gonna be doing the sensory part since I missed that one earlier. I'm gonna be touching different parts of your body with a sharp object and a dull object. You tell me where and what side it is. This is gonna be sharp. This is gonna be dull.
Okay.
Can you please close your eyes?
Sharp on my left hand,
Thank you.
dull on my right hand, sharp on my right feet, dull on my left feet.
Thank you. Now I'm gonna be doing balance. Do you have any walking problems?
No, ma'am.
Okay, so for that one, I'm gonna be doing the Romper exam. For that exam, I'm gonna have you standing up with the eyes closed for a minute. I'm just gonna see if you move around and to see how your balance is. Can you please close your eyes? After a minute passes, I would see if he continues standing up straight. In this case, he doesn't have any balance problems. Can you walk? Thank you. No balance problems.